Welcome back to Second Opinion. I'm Eli Stokols in Washington, and I'm joined by Dr. Patrick Soon-Shiong, the executive chairman of the Los Angeles Times. Dr. Soon-Shiong is a surgeon and scientist who has spent his career studying the immune system in order to fight cancer and infectious disease. He is also the chairman and CEO of the biotech company NantWorks and the owner or investor in other companies researching treatments for COVID-19. Tonight, we're also going to meet one of the leading medical researchers in the world, Dr. Carlos Cordon-Cardo of the Mount Sinai Health System in New York. But first, we're going to introduce you to members of a group calling themselves long haulers, coronavirus patients who continue to suffer weeks or even months after contracting COVID-19. There is no reliable statistic showing how many of the roughly 6.2 million people living in this country who have been infected by the virus are experiencing long-haul symptoms. There isn't even agreement really on what long-haul symptoms are. And a survey this summer of more than 1,500 members of the online support group Survivor Corps identified 98 different symptoms. Of the 10 most commonly reported symptoms, some are well known, like fatigue and shortness of breath, but others are less known. 746 people reported anxiety. 656 people reported dizziness. In fact, only 4 of these problems, the ones we're marking in purple, are part of the CDC's own list of COVID-19 symptoms. The mismatch between the health problems people are experiencing and the information from official health sources is noticeable and a potential cause for concern, the report states. That mismatch may also explain the rise of a number of online support groups for COVID survivors, which is where we met today's guests. Here are their stories.
My name is Sandra Louise Washington. I am a 58-year-old COVID-19 survivor. I live in Chicago, Illinois with my husband. I was told that I had COVID-19 at the end of March. I'm diabetic, and I had an appointment with my endocrinologist, who advised me to stay in a home because I was high risk. I eventually got sick over the course of a week or two. That's when I went to the emergency room and was diagnosed with COVID-19.
My name is Deborah Todd. I live in Marin County in Northern California. I woke up on March 13th with a really bad sore throat and coughing. And that's the day that pretty much my symptoms started, and they lasted for another, couple of weeks.
My name's Amy Tikel. I am 36 years old and I live in Mission Viejo / Orange County, California. The weekend before the official shutdown, I felt great. 100% wonderful. I could pull a car off a baby, you know what I mean? Super strong. And then Monday, about halfway through the day, it hit me like a freight train.
I'm Shamir Smith. I'm from Baltimore, Maryland. I'm 38 years old. I am a middle school teacher. I've been a middle school teacher for 5 years. I've been going through this grueling virus for the last 6 months almost, and I just got diagnosed. But I first realized that I had symptoms on Sunday, March the 22nd. It's a day I'll never forget. It just felt like some type of monster had invaded my body, and I couldn't really explain this to anybody. The urgent care refused to test me. They said, well, you don't have a fever. You don't have a shortness of breath. You're not here gasping for air, so you don't need to test. From there on, it's been a grueling task in trial for me to try to figure out to get somebody to actually agree with the fact that I had COVID.
I actually noticed that this was something that was gonna last, and it was gonna be a long haul situation for me when my hormones started going into overdrive. So I'm waking up consistently in a bed of sweat.
I feel clumsy when I've not really been a clumsy person. So that's a really strange thing. 3 days in a row, I cut myself, and then the next day I cut myself, and then the next day I burned myself, and then the next day I fell down, and it's just random clumsy things.
So at the beginning, there were moments I said, well, I'm going to die because I can't breathe. It's just a sickness of everything inside of you. It hurts to breathe, so you don't. You just stop because you're just I just need a break from the work. And then you're like, okay, got to take that breath. and you don't know what's going to happen in your sleep. And that was when I had the double pneumonia on top of it. Once that cleared, we thought I was getting better. We thought, okay, this is clearing up. And then things got way worse, and I had to go on oxygen.
There were days where I would wake up in the morning and I'd be like, okay, so who am I again? Who, when people would call and I'm like, who's this person? Like I couldn't, relate or couldn't remember who these people were. I'm an English teacher, right? I have a hard time still grasping on to words in my brain. I can clearly see the word in my head, but I can't say it. I am hoping that researchers will consider all of the ramifications that come when they ignore long haulers. We're missing out on work, family, just everything, because we're not being heard as much. We're not being heard of or about as much as maybe those more severe cases,
And joining us now are Sandra Washington, Amy Tikel, Shamir Smith, and Deborah Todd. Welcome to all of you, and thank you for telling us your stories. What an ordeal you have all been through. Shamir, I'll start with you. You spoke in the segment just there about your difficulty convincing doctors and medical workers to believe you about your symptoms and even to issue a test. A number of long haulers have complained about similar experiences. In your view, what problems regarding our healthcare system, or perhaps society generally, did this whole experience reveal?
It revealed a lot of problems that we have in our healthcare system. Sadly, I experienced a little bit of racial profiling when I went to emergency rooms, and I had a hospital stay in July where I was accused of being aggressive because I tried to convince a doctor to look at some research about neurological problems that COVID sufferers have, and he was like, "Well, you're being too aggressive," So I think that one of the problems that we face is that doctors are not willing to partner with their patients. I think with COVID, doctors have to go beyond the test. We find that, doctors are looking too much at tests and not enough at listening to our symptoms. I think right now with this virus, because it's so new, that we have to pay more attention to what people are saying about how they're feeling and their symptoms versus what tests will show.
Yeah, no doubt about that. Dr. Soon-Shiong, I know that you are very curious and interested in a lot of the things that our guests have said already. Do you want to jump in here?
This virus has unearthed the inequalities of our healthcare system. But more importantly, I think, and this is why I'm so pleased to have Dr. Cordon with me today, it also unearths the dogma. I mean, Shamir, maybe, and I'll ask you, Amy, and everybody else to feel free to sort of ask questions of us as physicians. But I think you had cataract surgery, right? You had some blindness. Maybe you speak to that, because I don't think most doctors would recognize getting COVID would create blindness.
Absolutely. And I still have not actually gotten any ophthalmologists that I see, even some of the top working people at a hospital that is one of the highest ranking in the country and the world. Nobody yet has made a connection that this was COVID related. I just last Thursday had cataract surgery. I'm a 38-year-old woman that has I've had prior to March, I've had a little bit of vision issues, sure, but 38 years old having an advanced cataract, that is usually unheard of. When I got my last eye exam in February, my eye doctor told me I would not have to worry about having any type of cataract surgery until I was like 50 or 60. When I got checked in May, after being told for 2 months that I had just dry eye, although I couldn't see anything out of my left eye, I was told, "Hey, you have an advanced cataract." I spent another month asking the doctors, "Hey, I think this might be related to COVID." And they kept saying, "Oh, we don't know because we don't see anything." And doctors still quite don't understand the hows and the whys of how it attacked my vision. And thankfully, I can see again. But for 5 months, I could not. And that was one of the scariest things about having this virus.
And, Dr. Cordon and I will discuss how we believe there's a unifying theory of what's going on in the body by actually this virus attacking this thing called the endothelial cells or these cells in the blood vessel wall. And we'll talk a little bit about that, and hopefully that'll shed some light on it. But Amy, you're one of the youngest here in the audience, or the patients here that have been infected. And I think this myth that if you're young and you get infected, nothing happens, you're invincible and you'll be just fine. Maybe you want to talk to that a little bit for us.
I mean, like I said before, is I did have leukemia in the past, and I beat it, and I was in remission for a few years. And to come from that and feel literally the strongest I had in decades, since high school, and then midway through the day, everything came to a halt. And by the next day, I was completely incapacitated. I could barely say my name, much less remember it. I could barely breathe. And since then, 180 days later now, I have a fever every single day. I've got 5 people in this house quarantined because of me. Like, what do you do with that? How do you even plan your future? I'm supposed to be planning my wedding right now. How do you plan a life when you could have permanent damage, which is, what they're telling me about my lungs and my dependency on oxygen.
And this is where the young people need to understand, and as recently as yesterday, when I watched TV on the gatherings that happened without masks and people in colleges without masks, maybe you want to just talk to that, because this is not just a respiratory disease.
Yeah, it breaks my heart. Like, you have to drop the selfishness inside of yourself. Is this worth completely ruining your life? Like, is a party really worth it? It's not a joke. It's not a meme. It's not a TikTok. It's not anything you want to call it. It is reality. And this is what can happen to you. You can have to wear oxygen and walk with a cane and be entirely dependent on somebody else to make you food and bring you water and help you bathe. Like, what kind of life is that for you? And how would you feel if you bring this home and you kill your parents or your sister or whomever?
Oh, thank you for that, Amy. And I think you can really hopefully inspire the young people to really hear that message. Deborah, maybe you would like to speak to us about your experiences a little bit?
Oh, sure. I got sick, and it was really hard. At the time when I got sick, there weren't really tests available, and it was all about getting tested, and it was just not possible. So I stayed home and quarantined. I make my living with words, and I have, since one of the major symptoms for me has been a loss of the ability to find words. I stumble a lot when I speak, to try to find the words I'm thinking of and to form complete sentences. And even when I write, it takes me a long time to write something that shouldn't take very long at all. So to see people who, on these support groups, there are people saying that their families don't believe them, or their friends are making fun of them, or their coworkers are, hassling them. And I don't understand that. This is a really serious thing, and it has a lot of long-term effects.
Well, Deborah, I think today, hopefully, with Dr. Cordon and the work that he's done, we can create a unifying theory. So this is not that crazy with regard to the symptoms. So we can actually identify these kinds of symptoms that affect the entire neurological system, and explains even the pain and the tingling and the numbness. So thank you for sharing that, because I think it's important for both physicians and patients to understand that this is very real. Sandra, maybe, again, similarly, if you could just share with us your experiences, so that everything that all of you are presenting to us is incredibly helpful for us as physicians and scientists to really understand that this is very real.
Well, my stay in a hospital was short, and I was in some very good care. I had some very good nurses taking care of me. I had some very good doctors taking care of me. However, what I wasn't told was what to expect once I came home. So after a month of being at home, I wake up one day and I look like a bottle of Heinz ketchup. I was red all over. And I tried to get help for it. No one would touch me. They were like, well, that might be a COVID-19 rash. And I'm like, what? And I was like, yeah, that might be a COVID-19 rash. So I was at the doctor's office and I actually had a nurse come out I thought they was coming out to see me, get my vitals. They came out and took me into the hallway and said, sorry, we can't see you. And I'm like, why not? And so I was livid because I'm like, okay, but I've been home for a month. And you said this virus only lasts 10 to 14 days. When is this ever going to stop? And I'm sure I'm not the only one that feels like this, but what the media has to come away from is telling people 10 to 14 days because that's a misnomer. It's not true, and it actually sets people up to actually suffer for a lot longer than what they should suffer.
I think you bring up such an important point, right? Because we do not know, and still we're trying to learn, how long does this virus survive? Can the virus actually reinfect? Or in fact, do you actually have an infection? Which then brings up to the whole idea of testing. And testing has become so confusing about what tests to have and what do they show. Do they show you, for example, after you've been home for a month and were you tested again, do you actually have still a live virus in your body? So have you been tested since that, and what kind of tests have you had to inform whether you still have the virus?
I'm glad you asked that question, Doctor, because it brings up a very, very good point that I'm hoping the viewers of this take away from. I did not get a second COVID-19 test, but I did get an antibody testing. And I received the antibody testing. Well, to me, that antibody testing is a joke because all it tells you was whether or not you had the COVID-19 virus. Well, I already know I have the COVID-19 virus. So what exactly is the antibody testing even showing you? It can't show you because no one has scientific data that can tell you whether the virus is going to come back or not. It can't tell you that. It has a little bit of meaning to it, but it doesn't. And I even laughed harder when I got the results from the antibody testing. The top of the page said negative, the bottom of the page said positive. And I'm like, what is anybody supposed to get out of any of it?
You know, you're so right, and in fact, you sort of raised a point that probably most doctors don't even ask. So the purpose of why you need to do the test and which test, you're absolutely right. We would predict you have a positive antibody, but that's not the question that you want to ask. Is do you have an active virus, which means the virus load. So hopefully through the work again of Dr. Cordon and in collaboration with the work that we're doing, we will be able to dissect out these different questions. So this is a monster. This is like, we will present a little bit like cancer, where we need to sort of figure out the stages of the diseases. And I hope that we can provide you some hope that by us understanding the details of this disease, that we can bring some not only relief, but some treatments to some of these symptoms. So I really want to thank you for participating. You've created a great service to our viewers and to us as physicians and scientists about this. And it is our hope that we can pursue the help to help you. Eli, I'd like to turn this back to you.
Well, thank you. And it's a great service, too, for journalists like myself, and I'm sure for the public, for all viewers who hear these stories, and hopefully will have a fuller understanding of what this virus means when you contract it, and hopefully will think about their behavior and hear your stories as they consider how to go forward. Sandra Washington, Amy Tikel, Shamir Smith, Deborah Todd, we wish you all the best. Thank you so much for being with us. Here to help us understand now what science has to say about our guests' experiences is, again, Dr. Carlos Cordon-Cardo. Dr. Cordon-Cardo is chair of the pathology department at the Mount Sinai Health System. That's a network of 8 hospitals in New York. He is also a distinguished professor at the Icahn School of Medicine at Mount Sinai, where he teaches pathology, genetics, and the science of cancer. Since the outbreak of the pandemic, Dr. Cordon-Cardo and his team have performed more than 100 autopsies on people who have succumbed to coronavirus. And his work is credited with showing that COVID-19 is not simply a disease affecting the lungs, as was commonly thought at the beginning of the pandemic months ago, but is instead a complex threat to blood vessels and multiple organs, including the heart and brain. Dr. Cordon-Cardo, welcome. And Dr. Soon-Shiong, you and Dr. Cordon have worked together for a long time on cancer research, and now you're translating that work from cancer to COVID and collaborating together to identify the stages of this new disease in order to help doctors diagnose and treat it. And your theory, if I understand it, is that this is a lot like cancer.
Thank you. Carlos, I can't tell you how pleased I am to have you join us and you hear now from these patients. And almost the sort of mystery that doctors sort of, when they see them, they can't even fathom the diagnosis. And so I thought it was really opportune and now important for the work that Carlos and I have been working on for many, many years with regard to cancer. And with full disclosure, I've supported Mount Sinai philanthropically and supported, even endowed their chair there. And so that we thought we would now collaborate on COVID. He's done over 100 autopsies, and I think one of the highest autopsies performed in the United States. And through his really, I think, breakthrough work of identifying at the autopsy level, so we really understand. If I may put up the slide of the work that we were talking about. And one of the things that we really want to do is show that this idea of from green to yellow to red, that COVID has stages, so that as you go through these stages of disease, it looks like cancer to us. So in cancer, you have a thing called stage 0, stage 1, stage 2, stage 3, and stage 4. And it is our desire, Dr. Cordon's desire, to create a unifying theory so that we can help inform not only the diagnosis through tests, but the treatments. So if we can create a framework for doctors to understand and publish this in some peer-reviewed journal, but there can be no better peer review in my mind than the autopsy findings that Dr. Cordon has found with regard to the results and how this disease has taken on the entire human body. That once it gets in, it actually behaves like this monster, it behaves like this cancer, and invades the blood vessels of the entire human body. So with that, I would like to open this talk to Dr. Cordon. If I can then have maybe the next slide and ask Carlos then to speak to his work of what he found in these autopsies. Welcome, Carlos.
Thank you, Patrick, and it's a pleasure to be with you and in an attempt to better educate ourselves, our community, and this is definitely not the disease that we expected when everything started. We knew that it was going to be a different battle. We didn't know much. There is plenty that we need to learn, but we have learned quite a bit. And I want to give credit to the members of my department that put their lives on the line and in being willing and ready to perform one of the largest series of autopsies. And they have created this biorepository that we hope is going to help addressing many, many, many questions. And originally thought to be a disease of the respiratory system, very early on we realized that some patients were coming, as we heard, from the wonderful patients that came into the program, that this was probably something different. People came not necessarily with respiratory illness, but with neuropsychiatric disorders, deorientation, loss of temporal memory, sometimes some delirium. And we said, this is something different. We didn't expect that. how we can learn. And fortunately, there were families and patients that produced the ultimate act of kindness and commitment to society, which is to say, I'm going to donate my body so science can reveal the kind of organ damage that this new virus is producing, and for us to be able to patiently look into all of these organs and try to go deep and try to understand where these pathologies, where these conditions were coming. And I like very much what one of the patients said, that sometimes the best doctor is yourself. You know when you don't feel well. And if you can relate that to us as professionals, we are going to learn more also. And we need to be open to all of the comments and not disregard any of the symptomatologies, even though it may not fit our book. But in this case, it's clear that this virus was not fitting any book. And we needed to understand not only testing and how we can do the diagnosis and the monitoring, but also the kind of organ damage and the kind of symptomatology that some patients were referring to us.
So when Carlos when you showed me the results and the thousands of tests that you had, and just so you know, Carlos had the vision, the amazing vision of creating collaboration across the entire New York, and had therefore the access to not only thousands of tests, but also over 100 patients. And when you showed me these results in the heart and in the brain, and showing where it affects the blood vessels, maybe, Carlos, you could speak to that, because this virus gets into what we call the ACE2 receptors of all the blood vessels.
That's right. And that was a moment also of inspiration and a moment of understanding and debating with friends and colleagues. And we said, in the same way that cancer may start in an organ, and then it can go through the blood vessels and produce this kind of a spread that we call metastasis. Metastasis, when we teach students, it's not only a term that we use for cancer in the context of transformed cells, malignant cells, to move from one side to the other, but also in the context of some other pathogens like bacteria and viruses. And we said, could it be that the receptors that these viruses uses to attach to the epithelial cells of the nasopharynx and later on of the lung, could these receptors be also present in other cells, maybe in endothelial cells, that they can produce not only the spread, but at the specific sites they may attach and produce pathology that is beyond what we were expecting?
You know, I think when we started the series on the science behind coronavirus and the second opinion, the terrifying thing to me was this concept of this ACE2 receptor. That this virus has figured out a way, as this intelligent machine, to adapt to us as humans, from bats to humans, and take on this ACE2 receptor. What scared me was this ACE2 receptor was in endothelial cells, as now Carlos has now shown. It's in the gut, it's in the lungs, and it behaves therefore like cancer, because it will then invade, this monster will invade. And then what it starts to do is exactly what Carlos is showing, is creating these thrombi and these microemboli and this inflammation. And this is what we're trying to describe, this spike protein, and how this intelligent machine has taken over. Imagine now the spike machine hitting this blood vessel wall and hitting the ACE receptor on every blood vessel. If I can then go to the brain slide, and ask Carlos about that, and then two slides down here. And Carlos, maybe you could speak to the frightening findings that we found and could explain why this patient has a cataract, why these patients have loss of memory, why these patients actually can't remember words, as you heard from the English teacher, why patients have depression, why maybe even have loss of taste and smell, because it affects different parts of the brain and even the nerves in the body. Maybe you could speak to this finding that you found in your Department of Pathology.
Absolutely. So we knew that that something was developing that was beyond the lung, and that was beyond the cardiovascular symptomatology that we were seeing. Patients came explaining the fact that they had lost, memory, that they had delirium, anxiety, and when some of these patients became very sick and finally, unfortunately, died of the disease, we were able to start exploring in these organs. It's the ultimate sacrifice to die of a disease, and then the wonderful act of kindness to give that, opportunity to us to explore what's happening. And when we started to explore specific organs such as the brain, we were seeing all of these hemorrhages, all of these microthrombi all over the place that definitely were impacting in cognition, that definitely were impacting in anxiety and other areas, because it was essentially all over. And then when we put these tissues under the microscope, we confirm our suspicion. The fact that not only there were microhemorrhages, but thrombi and thromboembolisms all over the place, and sometimes affecting more cognition, sometimes affecting some other areas that had to do with a speech impairment or this kind of deliriums that we have seen.
So these are the kinds of insights that is so necessary for us to explain to the young people, that they get infected. This potential happens whether you're young and old. What happens to your brain, what happens to the rest of your life. I think one of the exciting things now is, where is there hope? So when you looked at these microthrombi, and that's why the idea of now giving patients blood thinners early on in the disease to prevent that. But the question is, even the question that Carlos and I were even discussing is, are the platelets now affected? And do you give antiplatelet therapy? So let me bring it back to the slide of the stage of the disease, which is what this has maybe taught us. If I could get the slide back. So coming full circle now is you've learned from these patients the true sequelae of people that weren't on the ICU. These weren't people that were on ventilators. These were from young to middle age, with and without pre-existing conditions. They can go all the way up into the asymptomatic stage, which then brings us back to this one patient who said with great insight, what's the point of just having a test when I knew I was COVID positive? So which means then you really need to bring tests that when we get the vaccine, are there tests of immunity that actually can say that you actually have immunity, which requires then at that point an antibody test. And Carlos is now developing a quantitative antibody test. But if you have contracted the virus, do you still have a viral load? And there's another test that needs to be developed, which we were working with, full disclosure, again with Carlos, in which we've developed what we call the Q-LAMP test that can bring the test of the viral load. And then the question is, once you've treated the patient, is that virus still around? And that's a treatment test. So I'll open this up to you, and before we close, about the concept of explaining to both physicians, not just on the diagnosis and the stages, but the tests that are necessary, dependent on the stage.
From the very beginning, we thought that a qualitative test, a yes or no, was not going to be sufficient. For example, in diabetes, we cannot just say you have sugar in your blood. We need to look at your glucose, at very specific markers that are going to give us the context that, yes, you may be pre-diabetic or diabetic. And it's the same with this disease of viruses. To say yes or no, we thought that was not going to be sufficient. We wanted to know if you had a lot of viruses, intermediate or low amounts of viruses, because if you have a high viral load, as we call it, and you start sneezing, you can be a big spreader, but at the same time, you may be more sick than other individuals. And in the beginning, you don't know that. So we and others have published now studies in which the viral load, which may be one of the first tests that we can do, not only for diagnosis, but for helping staging and stratifying these individuals that may have, COVID-19, is going to be very critical. The same with antibodies. We cannot say yes or no, you have antibodies. That doesn't help you. If you have very low levels of antibodies, and if these antibodies are not awakened and ready to fight, you are not going to do very well. So from the very well beginning, we thought that quantitative and qualitative assays needed to go hand by hand, not only for the diagnosis of the presence or absence of the virus, but the amount, and the same with the presence of the absence of antibodies, but the amount and the opportunity for these antibodies to be really functional and address the killing of the virus.
Well, thank you, Carlos. And I, again, want to not only thank you, but honor the people of New York and people like yourselves who put your lives on the line to not only help patients, but actually trying to really break through this mystery of this virus so that we can actually better treat patients. So, Eli, I'll hand it back to you.
Well, I'd like to just pick up on that or spend a minute more on that point. Thank you. Dr. Cordon-Cardo, I just want to ask you a bit more about what you observed with the human toll of this disease. As you said in one of your published reports, the coronavirus affected New York disproportionately early on in this pandemic. And I wonder if you could just give us a bit more of a sense of what it was like in the hospital during the beginning of this crisis and what it meant to you to be able to be on the front lines of this crisis at that time.
Well, I think that I speak for our teams and for everybody that has been involved in this fight, that it's an honor to be able to be part of this fighting squad. And the reality is that, unfortunately, some of us knew that it was not a matter of if, but a matter of when. And we were discussing, we had colleagues already in China, in Wuhan, in the beginning of the disease. We saw it moving into Europe, and when it arrived here, we were never as prepared as we wanted it, but we knew that we were going to have a very difficult fight. And there were very difficult moments. There were moments in which, friends, colleagues became ill, very ill. The entire system was under a great deal of stress. We promised to ourselves, our families, and our community that we were going to try to stay healthy, but that our mandate and our passion was to further understand this disease and to bring knowledge, not just data, but knowledge, so we can address not only the diagnosis, but as Patrick was relating, also the treatment and how together we could coalesce a development that was going to honor the many that were sick and the many that die of the disease in order to make sure that we were going to be prepared for the next developments, which probably, unfortunately, as is happening in Europe and in the Southern Hemisphere, we are seeing that it may be coming back.
Well, I want to move just to the end of the episode. We always ask our guests for a closing statement and some hopeful thoughts somewhere, because these are hard discussions to have, and you've gotten us heading in that direction already. Dr. Cordon-Cardo, if you want to just offer some closing statements continuing on that thought about the information that you are acquiring in this research and perhaps the benefits of that in terms of finally containing this virus and the knowledge that we'll carry with us as we confront future pandemics.
Look, first of all, the data speaks by itself. Right now in New York, we have a very low rate of viral detection. It has been between 0.7 and 1.8, never even 2% for the last almost 2 months. So these are terrific news. I think that continuing to educate our community, our society is very important. We have learned from some of our colleagues in the Southern Hemisphere that this year the influenza may be even more controlled because people keep distancing and they use the mask and all of the hygiene that it's coming together. We also have seen an incredible race for treatment and vaccines that are already in clinical trials that they are very promising. So it's a good moment to reflect on what we have learned, to be positive, because again, the therapeutics are here to help us. And all of these new insights are going to open also the door to a society that I'm sure it's going to be different, but probably also more positive and more constructive than the one that we had in the past.
Dr. Carlos Cordon-Cardo, thank you so much for the work you're doing and for sharing so much of your research with us. With that, Dr. Soon-Shiong, your closing thoughts.
I think the light at the end of the tunnel is real. I think there is, with this kind of knowledge, the idea of creating therapeutics as well as the vaccines. But I think also what this is also helpful for is the idea that this will help us even the fight against not just this virus, but against cancer. And the fact that now we can understand memory T cells and how T cells may become important and how this virus has taught us what cancer is actually doing, and the acceleration of the knowledge that I think has come about as a result of this pandemic crisis is going to give us very much more quicker insight into how to deal with not just this infectious disease, but other infectious diseases. So that's the hope at the end of this tunnel, that we will learn something from this. And I do actually begin to sort of see the beginnings of the light. It may be in a distal tunnel, but I do begin to see some light.
Dr. Patrick Soon-Shiong in Los Angeles, thank you so much for that, for the optimism, and for sparking a lot of this conversation today. And that is our fourth edition of Second Opinion, our in-depth look at matters of health, science, and technology. I'm Eli Stokols in Washington. Until next time, goodbye.